Hi, I'm Jenn. I'm an aesthetic nurse here at Jae Kim MD, and today my beautiful patient is getting hyperdiluted radiesse for her neck. It's a beautiful procedure that can be done really anywhere on the body for skin tightening and also collagen production. So today what I'm doing is hyperdiluted radiesse. This is a calcium-based filler. When we say we hyperdilute it, it just means that we are putting it into a mixture and thinning it out. So as you can tell, I'm combining the two together to make a basically solution. And today, my beautiful patient Karen is getting her neck done. And so we're super excited about that. And right now I'm just mixing it back and forth so that everything is nicely mixed together. Hey Karen, how are you feeling?
Hi,
are you feeling good?
I'm feeling very good.
Most patients are concerned with the skin laxity of their neck, that turkey neck that patients talk about. And so there's really not anything out on the market that actually help regenerate not only collagen but elastin as well. And elastin is important because that's what gives the skin the elasticity or the bounce back or the snap back. And that's important in the neck area because that's our tightening, skin tightening that patients are looking for. I'm gonna cleanse you and then I'm gonna do some markings and then we get started. So now I'm just gonna do a few markings to make sure I know the areas I wanna go into. So all this right here that bothers you, all that right there that's bothering you. So I just wanna make sure that I mark, areas that I really want to address. Okay, excellent. Okay, you can lay back. Do you want a squeezy ball or does the distractor help you at all?
Squeezy ball would be great.
Okay, sure. This thing doesn't help you? This thing?
That helps too.
That helps?
Whatever
okay.
you got.
I got it all, girl. Okay, whatever you need. Okay, I got you. Okay, and feel me pinching you. 1, 2, 3, ouch. You okay?
Mm-hmm.
I'm trying to break up the neck band that's tethering down. So all these bands right here, we call it tech neck. Mm-hmm. That's, from looking down at our technology so much. So now that we have even a name for it. Isn't that crazy?
Yeah.
That's tech neck.
Hey there.
Hi, Dr. Kim.
How are you?
I'm good. Thank
Wonderful.
I'd say 90% of the fillers out there are the hyaluronic or gel-based fillers. And what it does is they help fill areas with volume loss anywhere on your face or sometimes your body as well. What makes Radiesse different is it's actually a biostimulator. And what that means is when injected, it not just volumizes, it actually helps regenerate. And that's the beautiful thing. The results are just supernatural, and I think that's what is the most exciting part about it. Result starts working in about 4 weeks or so, and up to about 9 months it's still working, so it gets better with time. It's, I think, very important that patients know, it's a slow process, but it's worth it because in the end you're getting the natural results and it lasts a little bit longer. It's up to 2 years versus a lot of the hyaluronic acids fillers out there only last 6, 9, 12 months. Hyperdilute Radiesse we can use for really anywhere on the body that we're trying to regenerate. The neck, the face, the décolleté, the knees. Abdomen is a huge thing with especially summer coming up, and everyone wants to look and feel their best, you know, taking kids out to the pool. I'm gonna see Karen back here in about 4 to 6 weeks, and we're gonna do the second round. Because typically, most patients will start out with 2 rounds, and then we go from there after that. But that's kind of the typical. I'm just gonna do a little massaging, and then that is it. So pretty cool, right?
Very cool.
So how do you feel? Good?
I feel good.
Okay,
Yeah,
awesome.
it was not bad.
It's not that bad, right?
Okay, no, it's not.
Okay.
It's not. I would recommend it.
Yay! I love that. Okay,
Thanks.
perfect.
All right,
We're
Miss
done.
Jenn.
Mhm.
Thank you.
You're welcome. To learn more about hyperdiluted radiesse, visit us online or call the office to schedule your consultation appointment.